Many decisions are made throughout pregnancy. What color should you paint your baby's room? Or what's your birth plan? These choices come later in pregnancy, but one needs to be made right from the start. And Marissa Walzen goes into greater detail for us tonight. Marissa.
That's right, China. Women's Care is full of OBGYNs and now full teams of midwives, helping women through every phase in life, including pregnancy. Women's Care wants newly pregnant moms to know that there are options for care.
Doctors and midwives work seamlessly with one another to give their patients the best care. Certified nurse midwife Brooklynne says midwives use evidence-based care and focus on the nutrition and the overall health of a woman during pregnancy.
Birth is a normal physiologic process, and so everything that we can do to support a woman's body naturally going through this process is what we focus on.
A midwife is an advanced practice nurse who has a graduate level training in women's care and obstetrics. They are a great option for a person that is generally healthy and has no pre-existing complications, or in other words, someone considered low risk. However, for those pregnancies that may be considered high risk, an OBGYN or a medical doctor that has completed residency in obstetrics and gynecology may be a better option. Women's Care doctor Heather York says an OBGYN is trained for problems that may come about with a high-risk pregnancy.
A high-risk pregnancy is someone with a medical problem prior to pregnancy, or someone who is older when they're expecting their child, someone who's had a C-section before, or a multitude of medical problems that might contribute to issues during the pregnancy, like high blood pressure or diabetes.
If a low-risk pregnancy becomes a high-risk pregnancy, Travis says the patient can risk out of a midwife's care. But with OBGYNs right there, it's easy to transfer care.
We have our doctors, our OBGYNs just next door, and we can, open the door and stick our head out, and we can have an OBGYN in the conversation that we're having.
On the other hand, if a patient is healthy and everything is going well in the pregnancy, an OBGYN may ask if the patient wants to transfer to a midwife's care.
It makes it very easy to collaborate our care together. So if they have a patient who develops a risk factor or has a risk factor, then we can work together on that patient, and having our midwives here in the office really allows them to continue to care for their patient just with support from a doctor when they need it.
It goes both ways, and I think that is important to highlight about a team, that this, that this is really a two-way street between the midwives and the OBGYNs, and it's a really healthy, a really fun collaboration to be part of.
And there are actually many similarities in care between midwives and doctors, including the fact that both deliver babies at Riverbend. But if you still are not sure which one to go with, a midwife or an OBGYN, Women's Care says you can have a consultation with both of them and then decide.